Hi dental fans, a question that I hear a lot from patients and viewers is, when can I eat? When can I eat after having a filling placed, or a tooth pulled, or an implant placed? In this video, I'm going to give you the definitive guide as to when and what you can eat after having dental work. The first thing I tell patients is to wait until the anesthetic wears off before you eat anything. Depending on which anesthetic your dentist used, parts of your mouth can be numb for 3 or 4 hours afterwards. When you're numb, it's really easy to bite your lip or tongue, especially if you've had work down on your lower jaw. Typically, half of your bottom lip and half of your tongue will be numb for dental work done on the lower jaw. After getting a white filling, you can eat right away once the anesthetic wears off. The filling material sets up when it gets zapped by the dental curing light, so it's rock hard. Same with dental sealants. They set up as soon as the light hits them. If you had a silver amalgam filling placed, wait about 24 hours before chewing on it, since it may take that long for the amalgam material to achieve its final strength. Chew on the other side of your mouth until then. If the bite feels funny after the anesthetic is worn off, call your dentist. The filling may need to be adjusted. After having a permanent dental crown placed, no matter what material it's made out of, you can eat right away. But be careful when you eat really sticky candies like saltwater taffy or caramel chews. You could possibly pull off a permanent crown. There's actually a dental tool called a Richwill crown remover that looks like a big jujube candy. It is used to remove dental crowns. You soften it in warm water, have the patient bite down on it, and then have them open their mouth, and voila! The crown comes off. Downside to it is that sometimes it can pull out a filling or the wrong crown if the patient has multiple crowns. With temporary dental crowns, avoid eating anything really hard or really sticky until you get your permanent crown. Since a temporary crown is made out of plastic, it's not as strong as a permanent crown and can crack. And it's held in with a temporary cement that isn't as strong as permanent cement. When you first get a denture or partial denture, start out eating softer foods until you get used to chewing with your new denture. Then start trying out other foods and see how it goes. The big one is when and what can you eat after having a tooth extracted. I made a whole separate video about what to do and not do after a tooth extraction that I'll leave a link to down in the description. But basically, after any type of dental surgery, eat soft foods like scrambled eggs, pasta, soup, etc. Don't eat or drink anything really hot, and avoid hard country foods like nuts, pretzels, tough bread crusts, and foods with a lot of seeds until after the area heals, which usually takes about a week or 2. If you had stitches placed, keep your tongue away from them. After you've had an implant placed, avoid chewing on that area until the area heals. If you have a healing abutment sticking up through your gums, or if you have a temporary tooth on your implant, don't put any pressure on the abutment or the temporary tooth while it's healing. Don't chew on the temporary tooth or healing abutment unless your dentist specifically tells you that you can. Otherwise, the implant may end up failing. Lastly, after a dental cleaning, you can eat right away. But I always like to enjoy that fresh mouth feeling for as long as I can before I eat. But if your dentist or dental hygienist place fluoride varnish on your teeth, only eat soft foods for the 2 hours immediately after having the fluoride varnish placed. And don't drink anything hot or any alcohol. And that includes mouthwashes with alcohol for at least 6 hours. Hot liquids and alcohol can soften or dissolve the fluoride varnish. Then you won't be getting the benefits of it. So I hope I covered the majority of common dental situations. I will make another video that covers pinhole surgery, since that's a pretty long list. If you have a question about a specific food or dental procedure, please leave me a comment down below. Thanks for watching.